This video shows how to use an Easyhaler. First, open the protective cover. Remove the cap and check the dose counter. Hold the Easyhaler upright and shake 3 to 5 times. This helps to make sure the powder flows properly. Make sure you don't accidentally click the Easyhaler as you shake. Holding the Easyhaler upright, squeeze down until you hear a click, then let it click back again. This loads the medicine into the mouthpiece, so only click down once. Make sure you keep the Easyhaler upright. To inhale the medicine, start by breathing out normally, away from the Easyhaler. Place the mouthpiece between your teeth and form a seal with your lips. Take a strong and deep breath in. Take the inhaler out of your mouth and hold your breath for about 5 seconds, or for as long as it is comfortable. If you have been prescribed a Bufomix Easyhaler, there is no need to hold your breath. Then breathe out gently, away from the inhaler. Make sure you don't breathe out into the inhaler, as it could clog it up. Afterwards, replace the cap. Close the protective cover. After taking your dose, rinse your mouth out with water and spit it out. If you click the inhaler by accident, or if you might have clicked it more than once, or if you breathe out into it, tap the mouthpiece to empty the powder onto a tabletop or the palm of your hand. Then start again from the beginning. If more than one dose is needed, repeat from the start. Remember to shake, click, and inhale.